Hello Year 9 and welcome to another science lesson. This is lesson number 2 of week 8 and we're going to be moving on from viral diseases, which we did yesterday, to bacterial diseases for today. So there are 2 bacterial diseases that you need to know in depth, but we will talk about other ones as we go through. So before we begin, as you can see, we have got a bacterial cell that has been, there's a picture of on the screen. What I want you to do, just to remind yourselves of some of the first lessons we did for lockdown, is comparing this bacterial cell to a plant cell or an animal cell. So what are the differences, what are the similarities between this bacterial cell and with animal and or plant cells? So pause the video, make a couple of notes and see how many you get. Okay, so you might have said for some of the differences, the bacterial cell has a flagellum, it's got a capsule going around the outside, and its genetic material is just found in the cytoplasm. Similarities, you've got ribosomes, cytoplasm, cell membrane, cell wall if you're comparing it to plant cells. You might have also said the names of the types of cells. The bacterial cell is a prokaryotic cell and the plant and animal cells are eukaryotic. Okay, so what do we need to know from this lesson? We are going to be able to name 2 bacterial diseases, and those 2 are Salmonella and Gonorrhoea. And I do appreciate I'm really bad at spelling gonorrhea. I always get it wrong, even though I've done it, obviously taught it for years. So I can understand that. Just give it your best shot. We need to be able to describe some of the similarities and differences, how it's spread, how it's treated, and things like that. And also for 7 to 8, we need to suggest why more people die from viral diseases now compared to bacterial ones. So bacterial diseases affect both animals and plants. So we did the viral diseases yesterday, and we saw on those that there are viral plant ones like tobacco mosaic virus, and there's ones that affect animals as well. And it's the same with bacteria, but bacteria tend to infect animals more than they do plants. And the reason for that is that bacteria have optimum conditions, normally humid places, so hot, with a lot of moisture in the air. So they tend to do better in tropical and subtropical regions. Now, in the early 20th century, about 30% of people that died because of infectious diseases, so these communicable diseases. Nowadays, that's a lot lower, much lower than 30%. And most of the infectious diseases that people tend to die of now, and not just because of the current pandemic, but in general, are viral diseases as opposed to bacterial ones. So what do you think has caused the drop in mortality rates? Why is it that many less people will die from infectious diseases now compared to in the early 20th century? Pause the video, have a think about it. If you want to jot an idea down or 2 ideas, go ahead, but you don't have to write it down. So you might have said the introduction of vaccines. You might have talked about penicillin. All of those greatly reduced deaths from infectious diseases. You might have said about better hygiene, better knowledge of bacteria and viruses, better sewage works, cleaner water. Any of those would have been great suggestions. So well done if you got those. Okay, next one. I want you to, for 2 minutes, list as many diseases that you can think of that are caused by bacteria. So these might be ones that you've had in the past. So think about if you've ever had to have antibiotics, what was that for? Or it might be ones that you have heard of as well. So pause the video, 2 minutes, as many bacterial diseases that you can. Okay, so we're going to go over some of the more common ones. As you can see in the italic writing, those are the Latin names of the bacteria. You don't need to know any of those. There will be some, like on the food poisoning one, there's a Salmonella one, an Escherichia coli, which you might be familiar with. But for the rest of them, those are the Latin names. You don't need to remember those. In fact, you don't need to know any of the specific ones that are on here, apart from Salmonella. Okay, so we've got eye infections. That's not caused by one bacteria. That's caused by lots of different ones. The three main ones are listed. You've got bacterial meningitis. So we do get viral meningitis, but there's also bacterial meningitis. And that's to do with the brain inflammation. We've got pneumonia. That's obviously, we know that viruses cause that, like COVID-19. Will cause pneumonia, but also lots of bacteria causes pneumonia as well. We have got skin infections. That's if you cut yourself and it goes all pussy. Sexually transmitted diseases, you'll notice the second one down ends with gonorrhea, and that's the one that we need to know is gonorrhea. Urinary tract infections, food poisoning, we need to know Salmonella. And lots of other ones, but you don't need to know all of those, so do not panic. But you might have thought of times where you've had to take antibiotics. I used to always have to have it for tonsillitis until I had them removed a few years back. You might have had to have it from other infections, urinary tract infections, anything like that. Okay, so here is a graph. And you can see it is showing the number of deaths in Scotland due to infectious diseases, so that's bacterial and viral, per 100,000 people. And you can see this starts off at 1911, and the rates are considerably higher than what we have now. It only goes up to 2001, but it's pretty much plateaued at that point. You might also notice that males are more affected by infectious diseases, and that's actually the same for COVID-19. It tends to, or the evidence suggests that it has a bigger effect on men than it does on women. So can you suggest reasons for that trend, not necessarily male versus female, but why the numbers of infectious diseases has gone down? Okay, so we're going to talk about some of the reasons why there is far less infectious disease deaths now than there was at the turn of the century. And a big part of that is improved living standards. So we are very, very lucky where we live, that everyone has access to clean water that doesn't contain bacteria. We have got sewage systems which take away all of the sewage, so it's not lying on the streets, which does happen in many places still. We've got vaccination, so vaccination programs where at certain ages you will have certain vaccinations. We've obviously got things like penicillin, antibiotics. All of those have reduced the incidence of death from infectious diseases. Why is it not the case globally, though? So why do you think that globally the number of deaths from infectious diseases has not necessarily gone down as much? It will have gone down a bit, but not as much as what it has in some of the Western countries. Okay, so here is an example. This is a picture of a town in Mumbai. You can see that it's very different to places in the UK, for example. Its sewage doesn't necessarily get piped underground and taken out. It can just be left on the streets. We can see there's lots of rubbish on the streets. People are very close together, living in very confined places, and that tends to cause diseases to spread a lot quicker. Now, the development of antibiotics had a huge impact on bacterial diseases, and that's why bacterial diseases tend to be less of an issue than viral diseases. So viral diseases still tend to be kill more people than bacterial diseases, and that's because we have antibiotics. But as we're going to look at or talk about, there are some bacteria that are actually becoming resistant to it. And that's obviously going to put us in a whole new scenario where we're not able to treat bacterial infections in any country. Right, so we're going to start off with the first of two bacterial diseases that you need to know inside and out. So the first one, the clue is the symptoms are fever, abdominal cramps, vomiting, and diarrhea. So what do we think that illness is? Hopefully you were able to realise it is food poisoning. Now, food poisoning is where you get those symptoms, but it's actually caused by different bacterial species. The one that you need to know is Salmonella, but also things like Escherichia coli or E. coli you might have heard of is also bacteria that commonly causes food poisoning. And this often comes from contaminated food, not so much for us, but it can also be in drinking water. So what we're going to do is, for the first bit, so you don't have to listen to my voice as much as you normally would, I've got two slides after this that are going to contain lots of information about Salmonella. And what we what we need to be able to do in exam is answer the questions that you can see on this slide. So how you do the next bit is up to you, and depending on what you have access to. If you have access to a printer, I would suggest taking a screenshot of the screen now and printing it so you can just write the answers next to it. If you do not have access to a printer, that's absolutely fine. Take a screenshot and maybe put it in a Word document and add your answers to it. Or if you like doing things the old-fashioned way, as I would, put the questions down, write down the questions in your notebook, and then obviously leave a space for you to put the answers. So you're going to have to pause the video now and pick one of those three options. Any one of those is absolutely fine, and then we're going to get the information. So pause the video now. Okay, so the next two slides are going to be packed full of information. I'm not going to go through all of what is on there. It's going to be your job to read through the information and select the information that answers those questions. So remember, there's two slides, so not all of it's going to be on the first slide, but by the end of the two slides, we need to have an answer to all of those. Okay, so here's the first one. So we've got symptoms of Salmonella food poisoning. We have got some interesting information on there, such as it takes from 12 to 72 hours to actually start developing those symptoms. But once you've got those symptoms, those symptoms can last 4 to 7 days. Most of the time, if you get Salmonella food poisoning, you won't need to go to the hospital or doctors or anything like that. People will, your bodies will fight the infection itself, and after those 4 to 7 days, you'll be absolutely fine. However, quite a few people who catch Salmonella will get severely dehydrated and will need to seek medical treatment or have things like rehydration packs from pharmacists or Lucasade, things like that, to help rehydrate. So next up, we got how do you treat it, and because the biggest way in which people can die, and it's very rare to die, but can die from Salmonella, is dehydration. The biggest treatment is obviously to drink plenty of fluids and replace those minerals that you lose, mostly from sweating. Who gets salmonella? Anyone, but like many diseases, the very young and the very elderly are the biggest risk factor groups. That's because neither of them will have the best immune system compared to sort of 18 to 65, 70-year-olds. As you probably know, with the whole COVID-19, it doesn't really affect children, which is rare for diseases. It normally will be the very young and the very old that are affected. But it tends to be those two groups that will have the worst effects. Also, if you have got any underlying health issues, so if you have HIV and experiencing AIDS or cancer, or drink too much, alcoholism also can have an effect, and that's to do with dehydration in the liver. How do you get infected with salmonella? So most of the time it's through foodstuffs. So eggs used to be a real issue. If you have got grandparents, they're probably very, very paranoid about thoroughly cooking eggs and meat, especially chicken. And that's because it used to be a really big issue. It's still, please don't eat raw chicken, it's still an issue. But it used to be even worse. Now eggs will be radiated to get rid of any bacteria. That's why they have the little red lion stamp on it. But also we do things like vaccinate all of the chickens to make sure that they don't get salmonella. If any of you keep any reptiles, tortoises, terrapin snakes, anything like that, they do tend to have a lot of salmonella in their digestive tracts, so that will end up on their skin. Dogs, cats, rodents also can become infected like we are, and then they can get it on their fur through feces and things like that. So if you would like to pause the video now, have a go at those questions that you had from the information on here, but do remember there is another slide to come. Okay, we're going to move on to the next slide. So here we have got a long list of ways in which you can avoid getting infected with salmonella, and this will actually be true for most of the bacterial food poisoning species. So things like making sure you're washing your hands regularly, especially after going to the toilet, preparing food, after handling raw food, after being in the garden, and also when you have been in contact with pets, especially reptiles and amphibians. Also, making sure food is thoroughly cooked all the way through and it is piping hot in the middle. If you read through the list, I'm not going to go through all of them, but making sure that you've got good food hygiene practice, so keeping things separate in the fridges where you store your food, only drinking clean water and things like that. Now, the World Health Organization, which you've probably been hearing about a lot more than you normally would, at the moment say that globally around 2.2 million people, mainly children under 5, are killed by diarrheal sicknesses, such as those caused by salmonella. So actually, salmonella and food poisoning is one of the biggest killers in the world. And that is because people dehydrate, because they don't have access to clean drinking water, which is so important. In the UK, we vaccinate, as I said earlier, all of our chickens and poultry to stop the spread of it. But actually, I think we're pretty sure, don't quote me on this, that the last time they checked, the most common way in which food poisoning was caught from food that you buy was from pre-cut salad leaves. So also making sure that you thoroughly clean any fruits and vegetables. Okay, so pause the video now. Make sure that you're able to answer all of those questions that you either printed or copied out. If not, if you can't answer some of them, then just go on to Google and you'll find a plethora of information out there as well. So we're going to move on to the next one. And you need to know, like with the viruses, you need to know an STI, bacterial infection. So HIV was the STD or STI for viruses. The one that we need to know for this one, as I've said earlier, is gonorrhea. But can you list as many STIs as you can? They don't have to be bacterial, any viral or bacterial STIs or STDs, as many as you can in a minute. So pause the video and try and name as many as you can in 1 minute. Okay, so hopefully you've had a go. You should have covered some of these in times like PSHE and Tuesday time in the afternoon, things like that. You might have put things like chlamydia, herpes, we said gonorrhea, HIV is another one that you need to know. There are quite a few. So any of those is great. Gonorrhea is the one that we need to know for bacteria. So, just bring this up. Now, there isn't, like with Salmonella, those 2 slides containing lots of information. On this one, I've made it slightly easier, and these are the really important things that we need to know. So, gonorrhea is an STD, sexually transmitted disease. So, it's spread through sexual contact. Now, early symptoms, so this will be a few days after you have got the infection, you will find that there'll be a thick yellow discharge, and that will obviously, depending on your gender, will be from the vagina or from the penis. And another symptom is pain during urination. Now, you might think that this is a good thing, but it's actually a bad thing. Very quickly, those symptoms disappear. So if you don't go to the doctor and get yourself checked out, then those symptoms will disappear. But gonorrhea doesn't just go away. Because what will happen next is that you might not think that you have it, it's just cleared up itself, but actually it then the bacteria starts causing long-term issues. And it can cause things like long-term pelvic pain, infertility, which means you are not able to get pregnant, and ectopic pregnancies. Also, if you are infected and you have a baby, then the babies that are born will often have very severe eye infections and even become blind. Now, that's why it's really, really important to make sure that if you have anything like a yellow discharge, which is actually a very common symptom for many of the STIs or STDs, if you're getting anything that is unusual, then make sure that you go and get yourself checked out. Unfortunately though, and this is the reason why you need to know about gonorrhea, is that there's quite a few strains, so that's slightly different versions of gonorrhea, ones that have just had a mutation. They're actually antibiotic resistant. So that means that when you take the antibiotics, which you would normally take if you have gonorrhea, it doesn't actually get rid of it. And that can cause serious problems. And it means that gonorrhea hasn't been treated to that person could be passing it on to other people. And as we've said, if you don't get it treated, then it causes these long-term effects. So this is the important bits that we need to know. So if you haven't done so, as I've been waffling on, can you make sure that you've got these key points about gonorrhea down? I would suggest putting it in your own words. It just makes it easier to stick in your brain. But you might want to pause the video now and complete that if you haven't already done so. Oh, and sorry, I missed that one. So obviously, like with many STDs, using a condom is the only way of preventing transmission. Okay, so the last bit for me. Can you answer these 2 questions? So the first one is discuss the implications of increased antibiotic resistance in the bacteria causing gonorrhea for the 106 million people who are infected with the disease each year. So the word implication, that means what's going to be the what's going to be the effects, what's going to be the bad effects of having this antibiotic resistant strain of gonorrhea. And that's going to be worth 4 marks. For number 2, write a paragraph for your local newspaper on food preparation for summer barbecues to help people avoid salmonella and other forms of food poisoning. So in this paragraph, you are going to have to talk about salmonella, and then you're going to have to give advice on how people who are having barbecues can reduce getting salmonella. And that's going to be 6 marks. So it's normally about a minute a mark. This should be taking you between 10 and 15 minutes. So can you pause the video and answer those 2 questions, please? Okay, so grab a different colour pen and we'll go through the answers. So gonorrhea, for question number 1, the implications of antibiotic resistant strains. Gonorrhea will become more difficult to treat, will be worth the mark. You could talk about how it's not serious in the early stages, or people might not get treated in the early stages. That'd be a mark. If left untreated, there's long-term problems, and you could have named one of those. That would be worth a mark. These long-term problems will increase as bacteria become more resistant. So these long-term problems, such as infertility, there'll be more of it. Okay, and that'd be worth the point. So in the second one, you had to do advising how to not get food poisoning. So you might have included some information about food poisoning symptoms. So you could have talked about vomiting, diarrhea, things like that. That'd be worth a point. If you have talked about how it can be gotten from contaminated meat or eggs and things like that, that can be worth a point. If you said that the bacteria is killed by cooking it, that would be a point. If you said that salads can become contaminated if you're preparing chicken, so if you're cross-contaminating raw food with food that you don't cook, that's going to be a point. If you said about cooking the food thoroughly, that's going to be a point. Making sure that it's hot in the middle and not pink will also be worth a point. So give yourself a mark out of 4 for the first one and 6 in the second one. Hopefully we were able to get all 10 marks, those 2 combined. But if you're picking up the majority of those, then that's brilliant. Okay, so hopefully from this we are able to name 2 bacterial diseases. So if you're asked, name a bacterial disease, you could put salmonella or gonorrhea. Hopefully you're able to describe similarities and differences between salmonella and gonorrhea, so the ways in which you get it, how it's treated, and the symptoms that you get from it. And then for 7 to 8, suggesting why more people die of viral diseases compared to bacterial diseases. So you could talk about antibiotics and penicillin killing most of the bacterial diseases, but antibiotics don't have an effect on viruses. Okay, well, that is it from me. This is actually the second time I've recorded this because I forgot to turn my microphone on. So sorry if it's a bit rushed on this, but I need to get it obviously uploaded before tomorrow. I hope you're all well and staying safe. Well done for continuing to access the lessons. Obviously, this is going to be how it is now until the end of the term, and we need to make sure that we're not falling behind. So very well done for coming on here and doing this. Right, take care of yourselves, and you'll hear from me in a couple of days, because I think you'll be lucky enough to have Miss Corbett doing tomorrow's one on fungal diseases and protists. Right, thank you very much, and goodbye.